Thank you again for joining us and for our webinar on debunking epilepsy misconceptions. I'm Allison Kukla, the Senior Manager for Programs and Partnerships here at the Foundation, and I'll be your moderator this afternoon. We asked a few months ago on our social media channels, what's the most common misconception about epilepsy you'd like to debunk? And we got over 400 comments. So we wanted to do a webinar to address the most common themes we saw in those hundreds of comments that folks submitted. We also want your questions during the webinar, and we'll ask our experts your questions during our Q&A portion of today. Just as a reminder, we're not able to give specific medical advice, so please keep your questions general in nature. And if you have specific questions about your health, always talk to your healthcare team about those questions. We are grateful to the speakers who are with us and all of you who are joining us today, like I said, from all over the country and some global outreach too. So I am pleased to have with me Drs. Monisha Goyal, Katie Laylor, and Kathleen Thagard. And as a person living with epilepsy myself, I'll chime in and provide lived experience comments as necessary. All of them bring a different expertise to the conversation, and I'll first introduce you to all of them, and then we'll start the discussion. So first, I'd like to introduce Dr. Goyal. She's an epileptologist and professor of pediatric neurology. Dr. Goyal received her medical degree from the University of Alabama School of Medicine with additional training at St. Louis Children's Hospital, the University of Pittsburgh, and Children's Hospital of Pittsburgh. Dr. Goyal's research interests are pediatric epilepsy surgery, seizure propagation, and seizure-induced metabolic efforts. Thank you for joining us, Dr. Goyal.
Thank you.
Dr. Laylor is a pediatric neurologist and epileptologist at Children's of Alabama, an assistant professor at the University of Alabama at Birmingham Pearson School of Medicine. She did her pediatric neurology and epilepsy training at Vanderbilt University Medical Center. She felt passionate about returning to her home state of Alabama to serve epilepsy patients, especially since she herself had epilepsy as a child. Dr. Laylor serves as the medical director for pediatric clinical neurophysiology, as well as the director of the pediatric epilepsy to adult transition program. She is also the assistant program director for the pediatric epilepsy fellowship program. Since moving back to Alabama, Dr. Laylor has been involved with the Epilepsy Foundation's Alabama chapter and serves on the Professional Advisory Board. Nationally, she is also a member of the CDC Center for Youth with Epilepsy Advisory Panel. Thank you also for joining us, Dr. Laylor.
Hi, everyone.
And last but not least, we have Dr. Thagard, who is originally from Jackson, Mississippi, where she received her medical degree from the University of Mississippi Medical Center. She then completed her child neurology residency at the University of Mississippi Medical Center and the University of Alabama at Birmingham. After completing her clinical neurophysiology fellowship at Emory University, she returned to UAB, Children's of Alabama, as a pediatric epileptologist. Dr. Thagard is board certified in child neurology, clinical neurophysiology. Her clinical interests include epilepsy education and counseling, neurostimulation, and epilepsy surgery. Outside of her clinical practice, Dr. Thagard enjoys spending time with her husband and dogs, gardening, and traveling. Dr. Thagard, thank you for joining us also today.
Happy to be here.
So welcome to all of you. I'm so thrilled to have you here with me as our experts. And again, just want to remind everyone as we go through our discussion today, if you have any questions, to please put those in the Q&A box. So I'm going to stop our share so we can see all of our speakers and we can get started on our discussion. So I'm going to start with Dr. Laylor. One of the more common misconceptions that came up is that all seizures are generalized tonic-clonic seizures or grand mal seizures. can you set the baseline for everyone? Are there more than one type of seizures? And what are the various types of seizures?
Yeah, this is a big one. Seizures can look like so many different things. Um, there are two major types that we talk about. One is generalized, where your whole brain kind of gets involved at one time. These can look like generalized tonic-clonic seizures, staring seizures, or brief jerks. But then you can have another type of seizure, which is called focal seizures, and these start in one place in the brain. And depending on where they start, they can look like almost anything. So there are innumerable seizure types, and the way they look is very individualized to each person who has epilepsy.
I would agree with that. I know with my seizures, they started general and now have just been focal for the past almost 20 years. So yes, there are definitely many types. So it's important to talk with your healthcare team about, your types of seizures. Dr. Goyle, as a follow-up to that, we also heard that people often think epilepsy is contagious. Can you address this misconception? Is epilepsy contagious?
Epilepsy is not contagious. That means you can't get it by touching someone or being in close proximity to someone. Um, Epilepsy can run in families. That means for certain types of epilepsy, there is a genetic component. But if you have a parent with epilepsy, or if you have a sibling with epilepsy, that does not mean that you're going to get it. Um, Unlike some diseases that are transmitted by a virus or infectious agent, such as COVID, for example, which can be passed on from person to person, epilepsy is caused by abnormal electrical signals in the brain. And those abnormal electrical signals cannot be caught by another person by transmission or by touch. So epilepsy is definitely not contagious.
Thank you for that clarification. Dr. Thagard, we're going to come to you with our next question. Often people think you need to go to the hospital and or, call 911 for every seizure that happens. What advice would you give regarding this misconception that we heard from the community?
So yeah, for most seizures, you probably don't need to call 911 or have somebody seen in the emergency room. Of course, there are certain situations when you do need to call 911 or, do need to have somebody seen by a medical professional. Those situations would be things like if the seizure lasts longer than 5 minutes or lasts a lot longer than that person's typical seizures, or if they're having shorter seizures that are kind of clustering together and the person's not waking up and responsive in between the seizures. Other situations would be anytime you're concerned about, their breathing, if they're turning pale or blue around the mouth more than their normal. Of course, if somebody is having a big tonic-clonic seizure, it's a typical part of the seizure for it to look like they're stopping breathing for a second, but that should, they should resume breathing as the seizure ends. So if it's different than their normal. Other situations would be kind of depending on where the person had a seizure. So if they fell and got injured, of course you'd want help. If the seizure occurred in water, while you're swimming or in the bathtub, things like that, of course we recommend a shower instead of a bath, but life happens. Then I would probably go ahead and call 911 just because there's some added risks besides just the seizure. Otherwise, you would just follow seizure safety protocols and, turn them on their side and time it and administer rescue medication as needed. If you do feel like you need extra support there or want, 911 just to come check them out, you're totally reasonable to call them for your support. And you can always have them check the vital signs, make sure that your family member or friend is recovering, and then you're not obligated to, have EMS or 911 take them to the hospital after that. They can just be there as a means of support for you wherever the seizure happened if you need it.
No, and that's a, wonderful response for that, because I know often, I'll tell my friends and family members, like, if it's my typical focal seizure, like, you don't need to call 911, just wait with me until the seizure's done and all of that. But as we heard, if it's not my typical seizure, please call 911. And if it's a generalized tonic-clonic seizure, we want to know what's going on and all of that. So I have that as part of my seizure action plan that I share with people so that it's, really clear and everything on when to call 911, when not to. But also, like you said, seizures can be scary when you see them. So like if you need that extra comfort level, it's definitely, important to have that. So I want to go to Dr. Laylor. I know I just mentioned seizure action plans, and I know that's an important tool for members of our community, and it came up when we were looking through the comments we received. Can you tell us more about what seizure action plans are and how they can assist individuals with epilepsy and those that support them?
Sure. So a seizure action plan is recommended for everyone who has epilepsy or is at risk of seizures. And what it does is basically takes the general things that we're talking about here, safety precautions, seizure first aid, and includes those, but also includes very specific things that may apply to any given person with seizures. So, we say, or as you were saying, Allison, you know, don't need to call 911 or go to the hospital if it's my typical seizure. So a seizure action plan may include a description of what your typical seizure looks like. And it's a tool you can use to educate those around you or whoever you'll be with on what to do when and if you have a seizure so that things go the way that you would like them to and you stay safe.
Yeah. And it's always, I work with my healthcare team to update mine regularly of, medication changes and things like that. So as you said, like it's a very important tool and, working with your healthcare team is, always valued with those conversations. Dr. Goyle, I want to go back to you. In the comments we received, we heard a lot about the general sense that people in the community view epilepsy as bad. So they don't want to talk about it. Would you talk about how epilepsy is not bad and it's just like any other chronic condition?
Yeah, unfortunately, just like mental illness, I think epilepsy is one of those chronic illnesses that is viewed as being bad. And I've experienced this in my own family, patient families, where they don't want it to be known that they have a member with epilepsy. I spearheaded a Help End Epilepsy license plate program in Alabama. But I encountered many families who didn't want to purchase it because it would identify them as a family with a member who had epilepsy. So I think, general knowledge about epilepsy, awareness about epilepsy is something that we can work on where the public feels more comfortable in discussing epilepsy and talking about their epilepsy. Epilepsy is just a chronic illness, just like any other illness. Unfortunately, the disease process itself causes unexpected seizures. So you can't predict when the seizures occur, and that may be uncomfortable. It can be an uncomfortable situation when they do occur. But we have to keep in mind that seizures are self-limited, usually less than 1 to 2 minutes, and many folks with epilepsy can lead normal lives despite having seizures. So we have to keep that in mind that people with epilepsy can lead normal lives. And so there's nothing inherently, quote unquote, bad about epilepsy.
I first want to say thank you for your response, but also thank you for your advocacy efforts around the license plate effort, because I know that has also spearheaded some work in other states around getting those license plates. So thank you for
Great to hear.
sharing that work that you did around that. And as a follow-up question to that, Dr. Thagard, what tips would you give, parents and individuals living with epilepsy around disclosing their epilepsy? Dr. Goyle kind of touched upon that, but I would love to hear your insights on that.
Yeah, so this is something that I talk to families a lot about, and it gets tricky, right? Because it is, on one hand, your private medical information, which, we don't like to share more about ourselves with medical stuff sometimes. But I think it's important to at least consider because it can affect you no matter where you are, which is, like Dr. Boyle said, it's sporadic and it can come out of nowhere. So when I talk to families and working together with families, besides seizure control, two of my primary goals are making sure that people with epilepsy are safe, and then helping advocate and support them so that they can live the normal lives that they want to live. For many patients, especially as people gain independence and become, adults, letting people know that you have epilepsy is an important part of that safety and allowing you to remain independent. It can be scary to share something about yourself, especially if there, are misconceptions from other people that you're sharing to about what epilepsy is and how it may affect you. So it's scary, but I think it is important for your safety, and you can share your seizure action plan, if you have a rescue medicine, where you keep it, how to use it, and sharing it. Besides safety, it can have some positive benefits. You can educate other people. You may feel less alone if you find out that someone else has epilepsy, or you may make somebody else feel less alone and feel more empowered to share their own story. It can also help for some situations if you need certain accommodations with school or your job. If they know that you have this diagnosis, you're legally entitled to certain accommodations and assistance. And so it can be helpful.
Thank you. And I want to go to Dr. Laura as a follow-up, and you were kind of perfect transition into my question, talking about accommodations and things. Are there any concerns to keep in mind when disclosing one's epilepsy, or, what tips would you give our listeners to best address these concerns?
I agree with everything that Drs. Goyle and Thagard said. I think it can be empowering to disclose and also safer. But we know that, as we've discussed, many people in the community don't understand epilepsy. They don't understand seizures. They may not know what to think if you tell someone that you have epilepsy. And so I think it's important to also know that under the Americans with Disabilities Act, while you are entitled to accommodations if you have epilepsy, you also do not have to disclose your epilepsy to a potential employer or a current employer, as long as they have more than 15 employees. So if unless you work for a very, very small company, that it is your choice on whether to tell them or not. And I have heard people say, oh, they asked me if I had any medical conditions, and when I told them, it seemed like they didn't want to hire me anymore, or things like that. And that's what it's really there to protect from, that you have it's your choice whether you disclose and when you disclose. And so there may be a time where it becomes necessary, but you do not have to do it until it is. And then I saw someone in the chat talk about medical ID, and I just wanted to add that, you're not going to be able to prepare everyone that you're around for your seizures or your family members' seizures. And so we do often recommend medical alert, ID bracelet, or now if you do have a smartphone, you can actually set a medical ID to show up on the home screen. If someone, were to be around you and not know what to do, your medical alert could come up as soon as they try to look at your phone in case they're trying to call someone, or things like that. So that, I think, is a sort of an innovative way to not everyone wants to wear a bracelet all the time. So that's kind of another way to make sure that you're protected, even if you're not around your close friends and family.
Yeah. No, thank you for those tips. Those are definitely important. And I want to actually pull one of the questions that came in too, that's kind of on this topic around disclosure and things like that. And anyone is welcome to answer this question. We have Beth, one of our participants, asking, any tips for parents of epilepsy diagnosed kids heading to college? I just want to let Beth know that we did do a webinar on navigating the transition to college, and we have that on our YouTube channel. So you were able to watch that, but I wanted to open that question up because I know we have some of our experts that focus on transition on the call. So anyone is welcome to answer that question.
Yeah, so in addition to the medical alerts, I think just knowing what their rights are, and I often tell my college students to go to the Office of Student Services and just let them know that they have epilepsy, even if it's not, they don't think they need any accommodations right now. Then if something comes up, they need to miss class, they, need to more time to get a test in or an assignment in, things will go more smoothly if the Office of Student Services already knows about their diagnosis. And then I would just say, it's hard. It's really hard to be in that situation, and sort of it's hard, I think, for any parent to let their child kind of become independent and spread their wings and move out of the house, but extra hard, of course, when the child has a chronic medical diagnosis. And certainly seizures is, I think, one of the more anxiety provoking ones because it is so unexpected. So other accommodations my college students have asked for are living on the first floor so they don't have to go upstairs. Either having a roommate so they have someone with them and are safe, or in some certain situations not having a roommate because they need to get their sleep and kind of have a quiet space to take care of themselves. So it's things you might not think about. So if there are things you think or I guess just trying to make it as much like a safe home environment as you can. And I often also, if you feel comfortable, making sure there's a local pharmacy that your child is comfortable going to and knows how to pick up medications, even if you don't get their meds filled there. That way they, have access to a place where they could get meds called in if needed, preferably some place they could walk to.
I know those are all helpful tips. I was diagnosed in college with my epilepsy, so you touched on a lot of the things that I had to do. So thank you for answering Beth's question. So I'm going to go to Dr. Goyle. One of the, say, most common misconceptions we heard in the comments that came actually is something I first heard when I was diagnosed, that you can swallow your tongue when you have a seizure. Can you comment on that for our listeners?
Absolutely. This myth has been ongoing from, I think, eons and eons. But tongues are not swallowed during a seizure. The base of the tongue is connected to the bottom of the mouth and lower jaw. And so there's no physically possible way that the tongue could be swallowed. Now, sometimes people mean swallowing of the tongue by what they mean is the tongue can drop to the bottom of the mouth. So if somebody is has had a generalized seizure or a generalized tonic-clonic seizure or is unconscious, then sometimes the tongue can relax and fall back to the bottom of the throat. And so the best thing to do in that situation is to turn the patient on their side to help prevent any obstruction by the tongue. But the tongue cannot be swallowed. I mean, it's just not physically possible. And I think turning to the patient to the side if they're unconscious with a seizure is a good precautionary measure. Now, sometimes you can have biting of the tongue with a generalized tonic-clonic seizure, and you can have chipping of the teeth if it's a very vigorous seizure, but otherwise swallowing of the tongue does not happen during a seizure.
I would agree. I think it's something that is often heard. So thank you for that wonderful explanation. And as a follow-up, I think this often goes along with that misconception. Dr. Thagard, it's often shared that you should put something in someone's mouth during a seizure. Can you comment on the dangers of doing this and the clarification when rescue meds are involved in that scenario?
Sure. So like many of you, I grew up hearing my grandmother say, oh, you need to put a spoon in their mouth, to prevent them from swallowing their tongue. And like Dr. Guo just said, you can't swallow your tongue. So we don't need to do anything for that. It's overall dangerous to put anything in somebody's mouth while they're having a seizure. You know, a lot of people have some involuntary or muscle contraction, and so they'll clench their jaws. They can't control it during a seizure. And so if you put anything in their mouth, they can bite down on it, and they don't have control over it, remember, and it, you know, break their teeth. It can shatter whatever the item is that you put in their mouth, and they can swallow it. And it puts them at additional risk beside just their seizure if they swallow it, especially if it were to go into their lungs instead of, you know, that's dangerous. It can give a pneumonia, create a pneumonia later. In addition, I've had some parents ask about putting their hands in their kid's mouth during a seizure, which I thought was interesting, but definitely don't do that, because then you'll get your fingers bitten and it's dangerous to the person having the seizure. So nothing in the mouth during the seizure, with the caveat that some people, depending on their seizure type, will have a rescue medicine that can usually dissolve under their tongue or in their cheek. You know, this is depends on the person with epilepsy, what type of seizure they have, and how that affects their body. So for some people, they can still swallow, excuse me, or it's still safe to use that rescue medicine as prescribed by their provider. I will say for many people, and then just in general, don't put anything in the mouth. We have a lot of new rescue medicines now that are nose sprays that act very quickly and are much safer for the patient.
Thank you for clarifying that as well. You know, and covering that very important misconception that is still, you know, lingering in the community. I want to highlight, and we've touched upon it already a little bit with some of the discussion, that the foundation offers free seizure first aid training. I know Dr. Goyle had talked about it a little bit. And it comes with a certification. It addresses how to properly help someone if you see someone having a seizure, and I'd recommend it to all of our listeners. You can go to epilepsy.com/first aid, and it'll walk through the steps on stay safe side and what to do, as I said, if you see someone having a seizure. I know we've gotten a few questions on that, so I just want to ask that to our experts.
On that note, that reminded me, I didn't mention this, but if you are looking for a seizure action plan and haven't been provided one by your healthcare provider, the Epilepsy Foundation has a form you can fill out as a seizure action plan. So I wanted to throw that out there while you were talking about the website. It has a lot of resources.
I appreciate it. I think hopefully my colleagues can toss that in the chat for our attendees. I was going to say, regarding that topic and seizure first aid, an attendee, Ken, asked specifically, what are the steps to take when someone has a seizure other than calling 911? I don't know if someone wanted to answer that, because I know we talked about when to call 911, when not to. Like I said, we have our free seizure first aid training, so I'd encourage everyone to take that. But would anyone like to comment further on that question?
Sure, I can do that. I think it very much depends on the type of seizure. So if somebody is moving around or having a lot of motion during their seizure, then you want to remove hard end objects or objects with hard edges so that they don't injure themselves. But the most common thing to do is not restrain them. So if somebody restrains a person with a seizure, the patient may, or the person may have more difficulty and get more violent or get upset. And so the best thing to do is to remove hard objects from around them so they don't injure themselves. Now, if somebody is shaking during a seizure and falls, the best thing to do then is to try to put something under their head so they're not banging their head against the hard surface, and turn them on their side. And if you see something in their mouth, like some vomit or something like that, then just side sweep it really fast. But best not to put anything in their mouth, like we've already discussed, and just observe them, make sure they're not, you know, if they have any tight clothing, loosen it a little bit. And the best thing to do, of course, is not to panic. Because that causes more problems than other things. And if the seizure is lasting more than 5 minutes, then perhaps and there's no awareness of their medical history, then perhaps you can call 911. But otherwise, most folks, you know, the seizure is over in 1 to 2 minutes, and they relax after the seizure and may fall asleep or be post-ictal. And being post-ictal means many different things to many people. So sometimes you can have a little confusion, but as long as they're coming around, that's the best thing to do. And again, the seizure first aid video is available, or training is available at the Epilepsy Foundation website. Please feel free to add anything that I forgot to add.
That's good.
No, I was gonna say that was perfect. And we'll put that link in the chat on where to get to our seizure first aid trainings. And we had another question come in kind of on the topics we were talking about from Kevin, asking, how do you recommend professionals with epilepsy position themselves in a workplace setting to welcome coworkers to ask questions about epilepsy? I would, you know, I've been in this position, so I'm happy to comment, but I would love to hear from our experts as well. You know, Kevin, in different jobs that I've had, I've disclosed and been open about my epilepsy, but as we've talked about, you know, that's a personal decision and, you know, it's for you to make. But I've held, you know, seizure first aid trainings in those work environments so that people knew what to look for, what to see, so that, you know, I felt safer in those environments. If I were to have one of my focal seizures at work, people knew what to do and everything. And it really opened up the dialogue for folks to ask questions. Because so often when someone hears epilepsy, they think of the seizures they see on TV or in movies. And with my focal seizures, you know, just zoning out a little bit or whatnot, people don't expect. So I've been able to, you know, have those open dialogues just by being open about it with colleagues, and they feel more comfortable to ask questions. I can show them a video of what my seizure looks like, and things like that. So I don't know if any of our experts would like to comment on Kevin's question. I know we've discussed disclosure a little bit.
So me as a sidelined person, I would love if somebody had epilepsy for them to be able to talk about it, to let me know that they have it, so that if I see a seizure or if I see anything, because it is unexpected, even though I am in the field and supposedly I know epilepsy or have some understanding of epilepsy, it would be nice to be told, so that if a seizure occurs, it is not unexpected, that I am more mentally prepared. Because I think mental preparation is one big thing in assessing or dealing with it, or interacting with, or even treating a person with epilepsy. And so to me, disclosure is very welcome.
I see the others nodding along with that. So
I would say that's been the experience of most of the people that I care for who have epilepsy, that when they did tell coworkers or classmates for the young people with epilepsy, that yeah, they had very positive responses, and the education was very appreciated by those around them. Of course, there are people who will never understand, but we can keep trying.
I think we can all agree by talking about it, that's how we help, you know, break the stigma and, you know,
Yeah.
make people more comfortable sharing and all of that. So yeah. We had another question come through. So Dr. Boyle, I want to bring this to you, regarding misconceptions around seizures and seizure medications. Do seizures cause brain damage, and do seizure medications cause permanent injury or side effects?
I'd like to dispel that myth that seizures cause brain damage. I think often seizures result from an underlying cause, such as a stroke, or sometimes we never know what that cause is. But usually it's that injury or the underlying cause that is causing the seizure, not the other way around. So in most persons with epilepsy, seizures occur because of an underlying cause, because of an underlying injury, not that seizures themselves cause the injury. So that I think for most people, seizures do not cause brain damage. Now, seizures usually are self-limiting, lasting 1 to 2 minutes. Some prolonged seizures can cause injury, but that very much is dependent on the type of seizure and what the underlying cause of the injury is. So in general, brain damage is not something that is occurring because of seizures. And then as far as medications, most medications, the newer medications that are on the market have a cleaner side effect profile, say, than some of the older medications. And so the spectrum of side effects is much smaller than what it used to be. And by that, I mean the side effects of the newer medications are usually milder and not permanent. So it's very unusual to have permanent injury from seizure medications. Sometimes if you are on many seizure medications, that may be the cause of some side effects that you may experience. But usually if it's a new onset medication, the most common side effects are sleepiness or balance issues that go away over time. But if there is a concern about side effects, I think the best strategy is to talk with your physician. But overall, the newer medications, they have cleaner side effect profiles. So the potential for permanent injury with a certain seizure medication, I think, is very, very low.
Mm-hmm. And I'll just add, based on some things I saw in the some other questions I saw, seizures themselves, you know, as Dr. Goyle was saying, don't cause brain damage. But when we talk about epilepsy, we mean that you are someone who could have a seizure and, you know, in an unexpected time, and we need to prevent it with medication. So seizures can happen from certain situations. In a case where someone doesn't have epilepsy, but if you have seizures that happen just out of the blue, then that's what epilepsy is. And certain epilepsy diagnoses do come with other issues in the neurologic system. So it can make it harder for people to learn or remember things, or people can have problems with their muscles. So there's such a broad spectrum, and the seizures themselves may not be the cause, but certain epilepsies can cause other problems.
Yeah, thank you for bringing that up. I did see someone asking about, you know, tips for improving memory and things like that. And there is a self-management program called Hopscotch that focuses on improving memory. And we have information on that on our website. And there's a way, you know, our local offices offer that program. So that's a program that you can look into if you're experiencing memory issues as a side effect of your epilepsy, to help, you know, improve your memory. So as you were touching upon, you know, there's different programs. I see someone, you know, highly recommends Hopscotch in the chat. I've done it myself. You know, it's a really good program. So there's different self-management programs out there around, you know, memory, mood, you know, things like that. So any questions about that, we have a page on self-management programs. We have gotten a few questions around safety precautions and SUDEP and seizure devices. So I just wanted to bring that to the panel as well. Someone had asked, you know, they worry about being unaware that their child has a seizure while they're sleeping. And I know that a link was shared in the chat, but just wanted to bring it to the panel. Are there certain devices or that you know, recommend, or where can they find the best information? And are there any other safety precautions to think about when, you know, living with epilepsy? And I know someone put in the link for the Danny Did organization. So that's one of our partners. So thank you for sharing that link in the chat with their wonderful device page.
I can start with this. So I get this question a lot as I primarily treat children with epilepsy. You know, parents are always worried about when their child goes to sleep and missing something, and you know, that can create a lot of anxiety and stress in the family. So To some degree, it depends on what type of seizure someone has. Some seizures tend to happen more at night and some tend to happen more during the day. So it varies a little bit, depending on the type of epilepsy someone has. Just kind of some general things I talk to families about, though, are that, in addition to medication and making sure that you're sticking to a good sleep schedule and getting a quality sleep, some things that can help ease anxiety are simple things like a baby monitor in the room, whether it's one that just has the sound or whether it's a video, so that if you hear something, you can look over and check on your child. The baby monitor or camera can let the child maintain some independence and still sleep in their own room, and then still give families some peace of mind. And I think that's really important in letting the kid, have some independence and get better sleep by themselves. There are some pretty cool devices available. One is the Embrace 2, or I think the new version is the Epimonitor. I've had some families this week actually raving about the Epimonitor. So for some seizure types and for certain families, those can be really helpful. It's almost like a watch. It's worn on the wrist. This tends to be most helpful for people who have a lot of jerking or rhythmic movements during their seizures, because it mostly picks up the motion. The caveat is if someone has just seizures where they just stare off or, pause for a second, it's probably not going to do a great job at picking that up. And the other thing is if they're wearing it during the day and it's a rambunctious kid, it's going to over call everything. So just, keep that in mind. Insurance may or may not help cover these, so they can be quite expensive. I do know that there are some kind of grants available to help cover these. The Danny Did Foundation is a good resource to check out that if it's something that could be helpful for your family. The other thing that I've had talked with a lot of families about recently is the newer Apple Watches or smartwatches have like a fall detection device or a sudden, kind of like an accelerometer in them, so that if you have sudden movements or a fall, it can be set up to send a notification to a pre-selected group of people. And that's something that many people already have or already wear, and can be a good tool.
Thank you for that deep dive into, the different devices and things like that. Looking at the chat, it looks like folks have experience with a variety of them too. And as you mentioned, there are grants available for, the different devices and things like that, and discount codes. So if you ever have questions like that, you can reach out to our 24/7 helpline and we can get you connected. Monitoring the time, I just want to toss another question out to everyone. We've heard a lot of misconceptions get debunked in the past 45 minutes. And also, some really helpful tips throughout the discussion from all of you. But I want to let each of you share any final thoughts you'd like to share with our listeners as, you're reflecting on the discussion and looking at the chat and things like that. So, feel free, we can go around and, share any final thoughts and tips with the group that we have with us today. Dr. Goyle, we can start with you and go around the group.
Sure. So I think we've come a long way from people with epilepsy being imprisoned because they were thought to be possessed by demonic, possession or something like that. However, I think misconceptions still continue. Let's face it, I think sometimes seizures can look scary, especially if we've never seen one before. So sometimes fear of a disease can lead us to formulate mental barriers because we want to avoid thinking about it or talking about it. But I think awareness and education remains the key ways to help alleviate some of the stigma associated with epilepsy. And whether it's, a teacher talking about epilepsy in the health class, or whether it's a patient with, or not a student with epilepsy talking about their epilepsy to their peers, or whether it's a discussion of seizure first aid with with extended family members or their church group. I think discussion and talking about the disease process is the key. And empowerment and education, the work that Epilepsy Foundation is doing, I think it's a great resource and a great entity that's playing a pivotal role in dispelling some of the misconceptions that still swirl around epilepsy. So kudos to you guys, and thank you for all the work that you are doing.
I would just say that, you know, for many people or most people with epilepsy, with the treatments and resources that we have available now, you know, epilepsy is part of your life, sure, but it doesn't have to be, you know, the controlling factor in your life. So for many people, if you work with your provider and have a good team of support around you, you can live a pretty normal life. You know, for most people, there's not a lot that's off limits. So,
and I'll just echo that. I think our goal as providers who take care of people with seizures is to, you know, of course, try to control them as best as we're able to. And even, you know, whether or not we can, then also trying to allow the person to live up to their potential, and have a good quality of life. And so I think, you know, important to know seizure, you know, certain precautions, you know, being careful around water, like Dr. Thagard was mentioning earlier, or, you know, being on a roof without safety equipment or things like that, if you think you could have a seizure. But then also sort of acknowledging all the things you can do. And really, I like to focus on that when talking to people I take care of, and that many, you know, many activities are very safe, and we want people to, and you know, you can have hopes and dreams and shouldn't give up on those, and should work with your provider to figure out what's safe for you and achievable for you or your
That's
family.
a really hopeful message to, you know, end our discussion on. So I really appreciate it. I'm going to pull up some resources, and I know we couldn't get to every question, but like I shared, we're not here to give specific medical advice. So if you did have those specific medical questions, please bring those to your healthcare team, and they'll be able to help you the best since they have your medical history. And I want to thank our panelists and our experts that were here today so much for sharing their expertise with us. I'm seeing a lot of love in the chat for you being here today. So thank you. Some of the questions that, you know, we weren't able to get to, we also have webinars on. So I want to talk about some stuff that we have coming up. Our walks to end epilepsy are happening all over the country currently, and in the coming month of June, we wanted to highlight we have walks from California to New Jersey and many places in between. So to learn more about these ones or to find one in your area, please visit walktoendepilepsy.org. We also talked, and I saw some questions regarding, you know, getting support, mental health support, meeting others, you know, that also have epilepsy. I know it took me a while to meet others with epilepsy. First person I met was 60 years old, and I thought I got an old person's disease. So, you know, I always found support groups really helpful to connect with others, like I think Dr. Thackard was talking about earlier. So at the foundation, we offer a variety of support groups for members of our community to connect and get support from one another. We also offer bereavement support groups for those who've lost loved ones due to epilepsy, because we know that is a very challenging time, and we want those families and individuals to be able to connect as well. So the calendars here show the ones that are offered in June, and our bereavement ones that are offered monthly as well. So you can visit our website to learn more about our support groups. And then for, like I said, I know we didn't get to all of our questions today. And if you have very specific questions, please talk to your healthcare team. But the foundation is always here to support you. So you can reach out to our helpline that is open 24 hours a day, 7 days a week. And the numbers are on the slide. It's available in English and Spanish. Or if you'd rather, you can email us at contactus@epilepsy.com. But we have our helpline specialists available to answer your questions, direct you, and get you the resources that you need. for any of the questions, kind of like we talked about, if you have questions about devices, getting grants, things like that, give them a call. They are a wonderful bunch and will get you the answers that you need. So, I can't thank you enough again to our experts that were here today to share their expertise with us and, some time with us, and all of our viewers that were here. And we hope to see you on a future webinar. So thank you for joining us this afternoon, and we'll talk with you soon.